So we are at the unique point in time, I think it's been said before, and discussions about funding challenges in the AIDS response have intensified over the past few years, and especially in view of ambitious targets such as ending AIDS by 2030 and expanding treatment to all people with HIV. Funding challenges and a call for increased overall funding is maybe more important than ever. And in these discussions, we hear, as Carolina said, the expressions like leaving no one behind, but also the need to do more with less sometimes. So in addition to looking at figures on actual spending and projected figures, I will also try to look at the reality behind some of these expressions as we see them. So, as Tobias has already explained, there's been remarkable progress. I will not repeat this. This is exactly the same figures just out, but also reminding of that 60% of people that are living with HIV still don't have access to treatment. And I think what is really important is to remember that these global figures are hiding disparities between countries and regions. So, just to illustrate that a bit, I don't know how much you can see the details, but this is a graph showing coverage rates. These bubbles are not as dynamic as Hans Rosling's, I'm afraid, but the blue bubbles to the left, they represent countries in Eastern Europe, Eastern and Southern Africa, and by size of the population affected. And coverage, the vertical axis is the coverage rate. And we can see in the green in the middle is Western Central Africa. That's a region that represents 7 million people living with HIV. But they are well below the 40% coverage average. Around 25% of people have access in this region to treatment. So it's just to show, and I think we as MSF, we've been trying to recognize this and say that we are actually calling for a catch-up plan for these countries. But there are also other regions that are affected in the same way, that are falling behind, such as Middle East and Northern Africa and Eastern Europe, Central Asia. So I think when we talk about progress, we have to really remember that international success must be measured wherever people are. And when we look at some of the policies and the funding environment, this is something really important to remember, that not to pit different countries against each other in the sort of competition for funding. So over the past few months only, we've seen quite some ambitious targets and goals being agreed by world leaders, not least ending AIDS by 2030 is part of the Sustainable Development Goals. And also UNAIDS and its members, including Sweden, also agreed to a new strategy for the next 5 years, with the notion of during the next 5 years, there's a window of a unique opportunity to actually bend the curve, but we need to front load investments. And by doing that, we will be able to reach the so-called 390s, that 90% of people know their status and 90% of them have access to treatment and 90% of them also have their viral load in their blood suppressed. So at the same time, and I think also really important to remind of the WHO, the recommendations from WHO to actually treat everyone with HIV upon diagnosis, and removing all of these eligibility limitations will mean that 37 million people are now eligible for treatment. So these policies and targets are all interlinked, and all of them recognize the role of community models and communities to advance progress. And while all of these are all really worthy and important targets and strategies, we are also confronted with a number of important challenges. So for MSF, some of these key concerns include the capacity and willingness in countries to adopt new policies and recommendations, the weak systems in countries, both in stable and unstable settings, with varying ability to provide and scale up quality of services. Human resources and procurement supply chain management are sometimes weak links that needs to be strengthened if we want to see progress. And both in countries and at international level, HIV is at risk of losing momentum. And not least then, of course, financial resources that is needed to allow for this boost to reach the targets that I will talk about more now, because looking back at the funding evolution, where are we today? We've seen an incredible, impressive increase in resources over the past 10 years. But we're also seeing now that this increase is starting to level off. As Tobias mentioned, the total investments in the AIDS response is now projected for this year to be at $21.7 billion US. If this turns out to be correct, this means a slight increase from last year, which was actually a dip last year. More than half of the funds are actually coming now from domestic funding from countries themselves, and in low and middle income countries. So it's important to remember that the current funding levels have been possible thanks to global solidarity and shared responsibility. So what does the projected funding need look like? UNAIDS, according to UNAIDS, to reach the 390s target and to bend the curves in the next 5 years, the international community needs to front-load investments and to increase to $31.1 billion US annually by 2020. And this means a gap of approximately 10 billion compared to the current levels of funding, or if you put it in a different way, the world needs to increase funding by 2 billion per year on average over the next 5 years. At the same time, we observe how leveling off of resources is already having effect in countries, and we're seeing funding gaps having impact on countries like Mozambique, for example. They embarked on a very ambitious treatment acceleration plan to expand access to treatment, but uncertainty about funding is risking now to put these plans on hold. And other countries are delaying upgrades of their treatment guidelines, such as earlier initiation on treatment or better treatment regimens and decentralization of care. Evidence-based programming, as was mentioned, for targeting key populations are also being put on hold. We see that in some of the proposals to the Global Fund, for example. Civil society organizations have also felt the decline, and I'm sure other speakers will speak about that as well. This is despite the fact that UNAIDS and all the latest evidence show that we really need to focus more on communities. So the challenges to reach these targets mean that we need immediate action to send strong signals and encourage countries to move forward with the right strategies. So we can't wait for if we are to meet these targets. So taking a look at some of the funding trends ahead, there are many of them, but just to mention a few. Donor funding, so not just international funding overall, but international donor funding is also leveling off after international financial crisis in 2008. We've seen a marginal increase in 2014 thanks to an increase from the UK government to the Global Fund. But with limited resources available, we also hear donors talking about the need to focus on value for money and to do more with less. But without a new push, these levels of donor funding might stagnate further or even decrease. And UNAIDS estimates that if we are able to front load now, we will actually see the funding needs to start to peak and start to decline by 2021. So not just sort of risking missing the opportunity of cost savings in the future, but also, of course, to bend the curves. So, for example, the Global Fund's replenishment in 2016 is a critical moment for such a new push, and Sweden has been one of the most important donors, and I think their continued support will be really important. Another worrying trend is the concentration of donors. In 2014, about 87% of international funding came from 5 donors, and the US government represented 2/3 of donor funding. Contributions to the Global Fund went up, and more donors are channeling their funds through the Global Fund. So when we're seeing so much of the funding for treatment going through the Global Fund and the US PEPFAR initiative, we really need to see these mechanisms appropriately funded and functioning and being able to deliver for countries. We also see many competing priorities, as mentioned, the Sustainable Development Goals, although interlinked. This is often also used as an excuse to say there are many goals, and HIV is just one of them. But I think it will be important to highlight that the impact of an effective HIV response will also have positive impact on other health goals. the fact that HIV is the leading cause of death for women in reproductive age and the second killer of adolescents in the world is quite important reminders for health goals. Other trends. Oh, there's something that happened there with the pictures. Sorry about that. The first trend there is a narrowing focus, and this is what Tobias mentioned, how we are now learning through lessons learned and through new evidence to narrow focus down on where are the epidemics, which countries, which populations, to better tailor these interventions according to the epidemics is really important. But at the same time, we're seeing a trend to focus on the highest prevalence and highest population countries, and there's a risk, as we see, to actually lose focus on some of these lower prevalence, lower coverage countries, such as those in West and Central Africa. Domestic spending has been driving the rise in international funding overall over the years, which is really encouraging. But there are some projections that are quite positive, whereas others are less optimistic, let's say. For example, a study in The Lancet in 2014 projected that many of the sub-Saharan countries will not be able to independently finance their response, even if they meet the Abuja target of spending 15% of their budget on health. So just a caution about too optimistic calculations there. This picture is supposed to symbolize the trend of that more countries are now transitioning from low to middle-income countries status. And this is used as an argument by many donors to pull funding out of middle-income countries. When using blunt criteria such as GNI per capita, rather than looking at countries' actual ability to pay, looking at, for example, fiscal space or the size of taxable population, we risk seeing funding being withdrawn too early, prematurely, and that gains will be lost. So even if a country is able to finance more, it's also a matter of political will and willingness to pay. This is a political problem, but it can be translated into a medical problem for the people living in these countries. And finally, to diversify income, countries are also advised to consider innovative financing solutions such as HIV levies and so-called sin taxes, taxes on tobacco and alcohol, for example. So these can be, of course, important contributions, but again, a country like Malawi, there was a study showing that even if this country would do all it can on innovative financing, it would only be able to finance 20% of its response anyway. So I think in combination, new innovative financing is important. Also at international level, looking at financial transaction taxes, of course, an increase in private sector funding. We need all of these sources in the response. Just to focus a little bit more on this trend of middle-income countries, it was mentioned by Tobias as well and others, but I think that just as a reminder that already today most people living with HIV live in middle-income countries, and UNAIDS is projecting by 2020 that only 13% of people living with HIV will be living in low-income countries. So, and to the right you see UNAIDS estimated shares between what is expected from lower income countries, lower middle income countries, and upper middle income countries to spend on domestic funding versus international funding. So it's just important to remember what is realistic here and not use these as strict targets, but rather estimates. For example, are new middle-income countries like Kenya and Myanmar able to spend 45%, to finance by 45% their own response? So to reach the targets, again, both country funding and international funders will be needed. And let's not be overly pessimistic about donor finances and overly optimistic about domestic funds. And this is just, I wanted to show this is a very recent study from that came out last week, actually, in PLOS, medical journal. It shows it's a study of funding needs for treatment at facility level. What is needed in terms of funding for scaling up access to treatment and to reach the 390s. And they conclude that countries, to actually reach these targets, countries need to go for a test and offer approach. And the funding needs for this 52.5 billion over a 6-year period is actually lower than many other studies have shown. And just putting it out there and we can discuss, but the funding gap today over the 6 years would be roughly 25 billion with this scenario compared to, almost 20 with the lower scenario. Finally, just to conclude, this focus on value for money, I think it's, and can we do more with less? It's important to remember, if we are going to reach the target, there will be a need for additional finances. So the answer could be said to be no, in that sense, that doing more with less will not do. And we need increases from both countries and donors alike. We also need to look at funding being directed towards people-centered approaches and to measure result at patient level. Are funding and services actually reaching people at the periphery? The call for a better focus on countries and people should not become a cover story for rationing of services due to limited resources. And we need better tailored responses, but the disease response must continue to have a global reach. And finally, if we talk about leaving no one behind, we need immediate action. And in order to upgrade and implement the WHO guideline, there must be a mobilization of both political will and financial support. Thank you very much.
Thank you.